Secure 65 health plans. We're senior.
Every Thursday on Secure 65 Health Plans, Talk Power Thursday brings seniors the straight talk they need to thrive. No fluff, just clear answers and practical strategies you can use right now. We dive into the issues that matter, trust you to draw your own conclusions, and tailor each episode based on your feedback. If you love what you see, like, share, subscribe, and comment to let us know which questions you want answered next. Now, let's explore the 13 big changes to your Medicare, Medicaid, and Social Security. Together, we protect our future today.
Secure 65 Health Plans Senior Q&A. Welcome to another session of Secure 65 Health Plans Senior Q&A. Today, we break down the latest changes in Medicare, Medicaid, Social Security, and more, keeping you informed, empowered, and confident. I'm your host, Moné Swann, CEO of Bivix Wealth and Insurance Solutions, and today's episode is part one of our deep dive into the Big Beautiful Bill. In this two-part series, we'll answer your most pressing questions, from benefit cuts to overpayment notices, so you could protect your hard-earned coverage and plan ahead. So grab your coffee, settle in, and don't forget, if you have a question we haven't covered yet, visit our website, secure65healthplans.com, and send us a message. Now, let's get started. Here's a brief overview of today's questions. How will the Big Beautiful Bill affect my Medicare Advantage benefits in 2026? What immediate steps should Medicare Advantage enrollees take to avoid losing extra benefits? How can Medicaid recipients avoid the paperwork purge and maintain coverage? What impact will Medicaid cuts have on local hospitals, and how can seniors respond? Is the promised $6,000 Social Security tax deduction real, and who benefits? What should I do if I receive a Social Security overpayment notice? Now, let's begin. Question number one. How will the Big Beautiful Bill affect my Medicare Advantage benefits in 2026? Okay, you guys, so this is what I'm going to say. Under the pay-go rules, any new legislation that adds to the federal deficit triggers automatic cuts. So although the bill didn't alter your Part A or Part B premiums directly, it does require Medicare Advantage, also known as MA plans, to absorb across-the-board reductions starting January 2026. So what changes, you might ask? Well, your plan's core coverage, hospital and doctor visits, they remain intact, but most of the extra benefits, you guys, like dental, vision, hearing, gym memberships, transportation allowances, and etc., are on the chopping blocks. Actuaries estimate reductions of 25 to 50% in many supplemental benefits, depending on your plan's cost structure. So you might ask, well, why does this matter? Well, many seniors choose MA plans specifically for those extras. Losing them could mean unexpected out-of-pocket costs. So what's your takeaway? Well, begin planning now. Review your 2026 MA plan options during annual enrollment, which is October 15th through December 7th, and be ready to switch if another carrier offers better value. Now, question number two. What immediate steps should Medicare Advantage enrollees take to avoid losing extra benefits? I love this question. So check for your July and or August benefit letter. CMS mandates that every MA plan mail you a 2025 benefits summary. Now, this is going to list your remaining allowances, like if you've got $2,400 left in dental or $600 in vision. Number two, use it or lose it. Schedule and complete any routine cares like cleaning, exams, gym visits by December 31st, 2025. Unused funds do not roll over until 2026. Number three, Verify online portals. Log into your carrier's member portal or call your case manager to confirm the balances shown in the mailed letter. So you guys plan ahead for 2026. Mark October 1st on your calendar. That's when the new plan details are available and when your October 15th through December 7th enrollment window opens. And if you really want to get ahead, call Bivix Wealth and Insurance Solutions at the number on your screen to compare plans that preserve the extras most important to you. Question number 3. How can Medicaid recipients avoid the impending paperwork purge? Oh, yeah, that's a great question to ask. Well, what's happening? The bill rescinds a law that previously allowed states to help you correct minor renewal mistakes. As of this year, any missed forms, any late check-ins, and even a one-day delay in submitting paperwork may cost you full loss of benefits. So here are my action steps. Number 1, contact your state office today. Medicaid goes by different names, so call us and let us help you navigate the changes before the renewal deadline. Number 2, set multiple reminders. Use a large print calendar, phone alerts, or ask a trusted friend to remind you 2 weeks in advance. Number 3, use registered mail or in-person delivery for critical forms. Obtain your proof of submission rather than relying on ordinary or snail mail. And if you're disenrolled, you must reapply from scratch, which can take weeks, you guys. So acting now avoids that risk entirely. Question number 4, what impact will Medicaid cuts have on local hospitals, and how can seniors respond? My answer to that question is hospital revenues are at risk. So don't forget that. Millions of medical patients translate to hundreds of millions in reimbursements. So cuts mean some community hospitals, especially in rural areas, may close or even scale back services. Why private equity matters. Investors often buy struggling hospitals, cut staff and maintenance to show short-term profits. Then they resell the facility. With lower Medicaid income, more hospitals become takeover targets. Your role as a senior advocate for others is to, number 1, call your local hospital administrator. Ask how many patients rely on Medicaid and whether cuts are putting operations at risk. Number 2, organize a community letter campaign, you guys. Work with your senior center or your neighborhood association. Why? Well, to protect any proposed service reductions. Number 3, engage state legislators. Hospitals are major employers and critical health resources. Make sure lawmakers know how important they are to your community. Question number 5. Is the promised $6,000 Social Security tax deduction real? And who truly benefits? Okay, so what you heard, a campaign-style email claimed single filers get a $6,000 break on taxable benefits or $12,000 for married couples. Well, the reality is this, you guys. This is temporary relief only. The deduction applies for a limited 2 to 3 year window. So you may be asking yourself, well, who pays taxes today? Well, only 40 to 50% of retirees currently pay federal income tax on part of their benefits. So if your income falls below the IRS thresholds, you see no change, and the trust fund loses about $54 billion annually without offset. And what are the long-term consequences? Well, removing that revenue accelerates projected benefit cuts from 2033 to perhaps 2032 or even earlier. My takeaway, higher income beneficiaries see a brief tax relief. Most seniors, especially those living modestly, get nothing, and all face steeper cuts sooner or later. Question number 6. What should I do if I receive a Social Security overpayment notice and see 50% withheld? Okay, you guys, let's start with why overpayments happen so you can make sure it doesn't happen to you. You may have returned to work, maybe recovered medical disability status, or simply had an administrative error. So what is the new withholding rule? Well, absent your response, Social Security can withhold 50% of your monthly check until the full overpayment is recouped. So now I know what you're thinking. Moné, how do I protect myself? Well, number one, act immediately. Don't ignore the letter. Number two, request a waiver if you believe the overpayment wasn't your fault or you can't repay it. File a Form 632 for reconsideration. Number three, set up a repayment plan, you guys. Agree to repay over 60 months, and you can usually do this at zero interest. Number four, consult free guides. Visit secure65healthplans.com so that we can help you walk through all of those downloadable forms. Okay, how do you feel? Did I answer one or most of your questions? If not, shoot us an email, write your comment in the comments below, or call us. We always have time for our community. Okay, you guys, so that's it. We're done with part one of our in-depth Q&A on the big, beautiful bill. You've heard 6 critical questions and concrete action steps so you can safeguard your benefits and advocate effectively. In part 2, we'll tackle questions about home and community-based waivers, Medicare savings programs, SSI interactions, and more. So until next time, stay informed, stay empowered, and remember, at Secure 65 Health Plans, we're here to help you navigate every twist and every turn in today's ever-changing healthcare landscape. I'm Moné Swann. Love you guys.
Secure 65 class plans, we're singing 5. Secure 65 health plans, where seniors thrive. 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 Secure 65 health plans, where seniors thrive.
BibX Wealth Insurance Solutions.